Have you ever felt dizzy, confused, or suffered a pounding headache, only to check your home monitor and see 170 over 90? In that instant, your heart races faster than your blood pressure and panic takes hold. You imagine the worst: a heart attack, a stroke, an ambulance ride to the ER. Many of us have been there, rushed to the hospital at the slightest hint of a spike. But here's the truth. Not every elevated reading demands immediate emergency care. Some spikes are false alarms, temporary blips that can mislead us into thinking our heart is failing when in fact, it is simply reacting to a momentary stressor. Today, I promise you will learn how to measure your blood pressure correctly when a high reading truly signals danger, and the single biggest mistake people over 60 make, one that could be quietly damaging your heart without you even realizing it. So let's get started. Number 1. Understanding blood pressure basics. Blood pressure is the force of blood pressing against the walls of your arteries, which serve as flexible pipes delivering oxygen and nutrients to every tissue in your body. Picture these arteries as garden hoses that expand and contract with every pulse of water. If the pressure gets too high, the hoses strain, and over time, small tears or bulges may form, weakening them permanently. Your blood pressure reading has two numbers. The first, or systolic pressure, measures the force when your heart contracts and pumps blood out. The second, or diastolic pressure, measures the residual pressure when your heart relaxes between beats. A reading of 25 over 72, for example, indicates that your systolic pressure is 25 millimeters of mercury, and your diastolic is 72. According to medical guidelines, a normal blood pressure reading is below 120/80, while hypertension is defined as 140/90 or higher. More recent research suggests keeping an eye on readings starting at 130/80, as even moderately elevated pressures can quietly strain your cardiovascular system over time. Yet it is vital to recognize that blood pressure is inherently variable. Climbing a flight of stairs, reacting to stress, sipping a strong cup of coffee, or simply talking during measurement can cause transient spikes. These are normal physiological responses, your body delivering extra oxygen and nutrients to cope with temporary demands. One isolated high reading, therefore, does not constitute chronic hypertension. It takes consistently elevated numbers, measured under proper conditions, to warrant a diagnosis. If you found these insights helpful, please subscribe now to receive more practical videos that safeguard your health and empower you with knowledge. Number 2. The worst mistake. Measuring at the wrong time. The most common and most dangerous mistake people over 60 make is checking their blood pressure at inopportune moments. Imagine grabbing your cuff the instant you've rushed home from an argument, or right after you finish yard work on a hot afternoon. In these situations, stress hormones coursing through your body, elevated heart rate, and dehydration combine to skyrocket your reading. You see a 160/95 and assume the worst, dialing 911 before you've even had a chance to calm your breathing and rest for a few minutes. This chain reaction leads to unnecessary ER visits, expensive tests, and sometimes even prescriptions for medications you don't need. The emotional toll is equally damaging. Anxiety over perceived vulnerability, medical bills piling up, and the psychological weight of believing you are suddenly one health crisis away from collapse. Mr. Johnson, 68, prided himself on his lush vegetable garden and spent most afternoons tending his tomatoes and cucumbers. One warm spring day, after hauling a bag of compost and trimming overgrown vines, he felt slightly lightheaded. He seated himself on the porch, wrapped the cuff of his home monitor around his upper arm, and read 155/95. Fear gripped him, and he called his daughter to drive him to the emergency room. Doctors ran EKGs, blood tests, and chest x-rays, but everything came back normal. Over the next month, he made 3 more ER trips after checking readings post-yard work and post-coffee. Finally, a nurse practitioner at his primary care clinic suggested Johnson log his blood pressure twice daily, once in the morning before breakfast and once at night before bed, for 7 days. At the end of the week, his average was 120/75, confirming his resting pressure was healthy all along. Mr. Johnson learned that timing and technique matter far more than a solitary number. If you haven't subscribed yet, please do so now. Your peace of mind and your heart will thank you for staying connected to content that helps you avoid these pitfalls. Number 3. How to measure blood pressure correctly. Proper measurement technique begins with the right equipment. A validated upper arm monitor rather than a wrist device, which is often prone to inaccuracy. Choose a cuff size that matches your arm circumference, and look for brands endorsed by reputable organizations like the American Heart Association. Once you have the right monitor, follow these steps each time you measure. First, ensure your upper arm is bare. Roll up long sleeves loosely or remove them entirely, so the cuff sits directly on your skin. The bottom edge of the cuff should rest about 2 finger widths above the bend of your elbow, with the cuff's artery marker aligned along the inside of your arm where the brachial artery runs. Next, position yourself comfortably. Sit with your back fully supported by a chair, feet flat on the floor and uncrossed, and your arm resting on a flat surface at heart level. Keep your legs uncrossed and your body relaxed. Before taking a reading, avoid caffeine, smoking, eating, or vigorous activity for at least 30 minutes. Sit quietly for 3 to 5 minutes, allowing your cardiovascular system to settle. Do not talk, move, or handle distractions during the measurement. When ready, start the monitor and remain perfectly still and silent. Once the reading appears, record both numbers. Wait 1 minute, then take a second reading at each session. Perform 2 readings and calculate the average of those values. Repeat this routine twice daily, once in the morning before taking medications or eating, and once in the evening before dinner. Log your averages for 5 to 7 consecutive days and bring the results to your healthcare provider. Consistency is key. Always measure on the same arm. The non-dominant arm is fine, and stick to the same time windows for comparability. By mastering these techniques, you transform random spikes into reliable data, empowering yourself to make informed decisions. Number 4, when to worry and when to wait. Not every high reading demands immediate action. However, there are circumstances in which delaying care can be dangerous. If your reading climbs to 180 systolic or 120 diastolic or higher, and you experience accompanying symptoms such as chest pain, shortness of breath, severe headache, vision changes, confusion, or sudden weakness on one side of your body, you may be facing a hypertensive crisis. In these instances, seek emergency medical attention without delay. These warning signs indicate that dangerously high pressure may be damaging vital organs like your heart, brain, or kidneys. Conversely, if your monitor reads elevated but you feel perfectly well, resist the urge to panic. Sit quietly for 5 minutes, then recheck your pressure. Often the number will fall back into a safer range once you've allowed stress hormones to subside. Remember that hypertension is known as the silent killer. Many people experience no symptoms even as their blood pressure remains dangerously high for years. Regular, calm monitoring under consistent conditions is the most reliable way to detect and manage elevated pressure before it wreaks havoc on your health. Number 5. Habits to lower blood pressure naturally. Your lifestyle choices play an outsized role in controlling blood pressure, sometimes even more than medications. The first habit to cultivate is reducing sodium. Processed and packaged foods, from canned soups and deli meats to snack items and frozen dinners, often contain hidden salt far exceeding your daily needs. Aim to prepare fresh meals at home, flavoring them with herbs, spices, garlic, lemon, or vinegar instead of salt. When you do add salt, measure carefully and keep it under half a teaspoon per day. Second, boost your potassium intake. This essential mineral helps your body eliminate excess sodium and eases tension in your blood vessel walls. Bananas, sweet potatoes, spinach, beans, avocados, and yogurt are rich sources of potassium. Third, maintain a healthy body weight. Carrying even 10 pounds of excess weight strains your heart and raises your blood pressure. Losing as little as 5 to 10% of your body weight can significantly lower your readings. Fourth, engage in regular physical activity. Aim for at least 150 minutes of moderate intensity exercise, such as brisk walking each week. Exercise strengthens your heart and improves arterial flexibility, allowing blood to flow more freely. Finally, manage stress through deep breathing, meditation, yoga, or nurturing social connections. Chronic stress keeps your blood vessels constricted and your blood pressure elevated. Taking just a few minutes each day to practice relaxation techniques can reduce your average blood pressure and promote overall well-being. If you found this guide valuable, please subscribe now for more in-depth videos on protecting your heart health. Number 6. Heart-healthy foods for over 60. Beyond sodium and potassium balance, certain foods offer targeted support for your cardiovascular system. Leafy green vegetables, spinach, kale, Swiss chard, provide nitrates and magnesium, which help dilate blood vessels and improve circulation. Berries such as blueberries, strawberries, and raspberries are packed with flavonoids, antioxidants that protect arterial walls and aid healthy blood pressure regulation. Beets and beet juice are rich in natural nitrates, which convert into nitric oxide and relax blood vessels. Incorporating even a small glass of beet juice or roasted beets into your diet can yield measurable benefits. Oats deliver beta-glucan fiber that not only lowers cholesterol but also enhances blood vessel function. Fatty fish like salmon, mackerel, sardines, and trout offer omega-3 fatty acids that reduce inflammation and support vascular health. Aim for 2 servings per week or consider plant-based sources such as flax or chia seeds if you prefer. Garlic contains compounds like allicin that promote blood vessel relaxation. Adding fresh garlic to meals several times weekly provides a natural blood pressure boost. For chocolate lovers, a small square of dark chocolate, 70% cocoa or higher, can improve circulation, but moderation is essential to avoid excess sugar or fat. By weaving these foods into your daily meals, you create a nutritional shield that protects your arteries and supports lasting health. Number 7. Avoiding common myths and pitfalls. Misinformation abounds when it comes to blood pressure management. One persistent myth is that high blood pressure always causes noticeable symptoms. In reality, hypertension often remains entirely silent until it triggers a serious event. Relying on symptoms like headaches or dizziness to gauge your pressure is a recipe for disaster. Another myth holds that achieving a normal reading on medication means you are cured and can stop treatment. In truth, antihypertensive medications control pressure. They do not cure the underlying tendency. Discontinuing medication without medical guidance can cause dangerous rebound spikes. A third misconception is that young people need not worry about high blood pressure. Hypertension can develop at any age, particularly with diets high in processed foods and sedentary lifestyles. Early detection is crucial to preventing future complications. Some also believe that natural remedies alone are sufficient. While diet and exercise profoundly impact blood pressure, they are not a substitute for medical care when needed. The most effective approach combines lifestyle changes with appropriate medication under professional supervision. Finally, neatly setting and forgetting your healthy habits is not enough. Blood pressure management demands lifelong commitment. Returning to old patterns can swiftly erase your progress. By understanding and dispelling these myths, you empower yourself to make informed choices and maintain stable, healthy blood pressure for years to come. Throughout this journey, you have learned that properly measuring your blood pressure, choosing the right time to check, and consistently tracking your readings are foundational steps in safeguarding your heart. You have seen how a single misplaced reading can spark panic, unnecessary treatments, and emotional distress. Yet with the right timing and technique, you can transform randomness into reliable data. You have discovered 5 powerful lifestyle habits and a palette of heart-healthy foods designed to support your arteries as you move through your golden years. You have also learned to recognize dangerous myths and pitfalls that can undermine your efforts. Now, equipped with this knowledge, you hold the keys to protecting your cardiovascular health. Protecting your heart means measuring wisely, acting prudently, and nurturing habits that foster long-term resilience. Do not let one inaccurate number derail your peace of mind or your well-being. Reflect and share in the comments below one small change you'll implement today. Perhaps drinking more water, adding a handful of spinach to your lunch, or practicing 5 minutes of deep breathing before bedtime. Your choice could inspire someone else on this journey. If this video resonated, please hit like, subscribe for more practical science-backed health guidance, and click the notification bell so you never miss an update. Your future self will thank you for taking these steps now. One measurement, one habit, one day at a time toward a stronger, healthier heart.